I think this March. The NHS Commission Board, that's the people who are doing everything on the NHS. And medical director, who including all the medics supposed to be, but as you can see, right, Chief Scientific Officer, Professor Su, is one of those. She is a medical director. She is one of the leading people in the NHS who is making decisions at the most hard times. And if you just see below, nursing directors and those as well, another part, as here they call them allied health professions. But at the same time, I just wanted to say something. The nurses in the UK, they are powerful. Really, they get away with many things. They write prescriptions like doctors. They do manage critical cases. They do have a big responsibility, but they are not included in that medical directory. So that means jumping there is not really an easy job. If you just look underneath the, I think, or just up of the Chief Pharmaceutical Officer as well. By the way, pharmacists in the UK are not doctors. They don't consider that doctors, but they are still fighting. They are doing lots of work, and now they are acknowledged to be as clinical practitioners to do some work, work like doctors or nurses. And for you as well, they just started having laboratory medicine staff doing rotation on the wards, asking patients what test is being done and what the next one, and they do that on the spot. And report that on the file. So it's not stopping there, it's ongoing. I wanted to tell you something. When I left from here to the UK to do my MSc in cellular pathology, one of the pathologists who was teaching us histopathology, during the lecture he came and he leaned on me and said, where are you graduating from? I told him from Sudan. And he said, you just got your medical degree or have you done anything else? I told him, no, I haven't done medicine. I did medical laboratory science. He said, wow, how did you know all that? Because he was asking for certain cases and I was answering. And I got my colleague as well, Sarah. She was expecting me, I think, but no. So he said, so tell me anything about the courses you're doing in Sudan. I told him it's a 4-year course and starting with anatomy and physiology and clinical biochemistry or biochemistry and then going on. We studied in depth histology and then all these specialties in medical laboratory. Sorry, just improper obligation. Then he said, okay, what they call you when you graduate? I told him, we were shocked when we were graduated as we didn't expect what was going on. We were expecting that we were going to be a laboratory doctors or whatever, something like that. He said, have you done any internship? Have you been supervised by a pathologist? I told him, no, there is no chance. He said, why? I told him, because they think you are not qualified. He said, you are more than qualified to be supervised. And you can do a great job other than training a pathologist for 10 years to do this. Really, just coming back to say, the syllabus we got here 10 years ago, and I'm very sure it's much, much better now. It's really far away from UK syllabus. Biomedical science. Biomedical science in the UK is all about science. They teach you science. They teach you about respiratory diseases, urinary diseases. They give you much science. No practice, no lab practice, apart from some work on molecular biology. Might be they give you some microbiology slides to stay. Only a few things. But I'm pretty sure everybody graduates from there. They can do anything in any laboratory, even routine. They can do unit job. Right. UK, they got a training system which is really very informative. But how long? 18 months at least. And all the times you'll be assessed. Because they don't have any background on, why they are doing the process. Some of the students exit at a certain time and go and do some training at the hospital for 1 year and come back to finish their degrees. But still, it's far behind us. I think if I got any student graduating from any university in Sudan, I'll ask him, I'm very busy tonight, could you discover me, do your teamwork for me? Will you? I'm very sure we'll get all the malaria results fine, all the hemoglobins and all the generals and all the additional things. He might be able to do that. In the UK, without training, they can't do anything. So, we are advanced steps. We could do a lot, but we are lacking for clinical leadership. We don't have clinical leadership. We don't have training here. But let me move. Right, the stage where the UK at the moment, how can we make it here? I just can shed light on certain points. We'll go through education, and then technical, and finally clinical. Right. I really just felt so sorry that we've been capped to do only 4 years. It should be for everybody to do 5 years and graduate with 5 years degree. Why I'm saying this? I'm saying this because that would put us on a higher level within any employer. Okay? Because here we just rely on how many years. Even in the UK, if I said, I'm graduated from a medical laboratory science college with 5 years training and studies, they'd say, okay, who you are then? They might really accept that you are a medical doctor being trained on that specialty, rather than having 4 years and you are not there and you are not back there. You are not a technologist and said that you are not a pathologist. So 4 years is a bit short. I'm hoping that the professors here, doctors here, the people who are holding the role of responsibility in their colleges. I know that Khartoum University are doing pretty good, and Professor Zakria really acknowledged that, and we are so proud of that. But I hope that we all learn to all students, not only for those distinguished ones. The other thing, we could do another thing. We got overqualified people. How come somebody who did BSc, MSc, PhD, and got professorship when you go to the lab and then tell him you are a technologist. It's not acceptable by any means. Even those names being just emerged from the new council, still not in the reality. It's not there. How we could get at least our colleagues, the medical professions, to know who we are, what are we doing. So there's a big job there for the council to do this. I think I'm running out of time now. Modern pathology in teaching laboratory medicine. Modern methodology. I mean by this, we could switch a bit. I wanted some clinical experience. What I mean, I don't mean to drop the technology. No, that's our success, by the way. We need to handle both. Because if you got a pathologist left in a lab on his own who could not do the job, he is a knowledgeable person. He did a medical degree, he did 10 years. I'm talking about UK companies. He can't do anything. Right. So technology is important. But I'm suggesting to have a postgraduate training. During this training, to be appointed to have an MSc or a PhD. And it should be unique for that profession. I say hematology. When it started in the UK, they started asking those trainees to do a PhD while they are doing training for 3 years. When they graduated, they are equivalent to a consultant hematologist. Right. Critical evaluation and thinking. To be, having a clinical role, you should really be educated and having the skills to, you have the skills to critically evaluate the test results. And you should have clinical knowledge to connect this and that. And you should come up with what's wrong with that patient. Then you could give advice. Then you could, attend MDTs, multidisciplinary team, which is talking about patients' cases, which is, I don't think it's in Sudan. But there, I'm not aware of any organized way like that.
Unfortunately, we are not involved.
Exactly. So we are not involved because I think, and I believe that we are not qualified enough because we're missing a lot of clinical knowledge. We've been guided through just to do the technical work in that. Anyhow, that's our role. I'm still holding that. We're not going to leave that. Okay? But we need expansion because we are not staying at the BSc. We are going ahead, MSc, PhD, and further. So why not having that role? Canada, America, everywhere you go, when you go higher qualifications, just go, you do MD. Why not? You could do MD in medical degree. Right. Moving from theory, teaching to actions. And I meant by this, what does it mean if a pathologist is coming to a histopathology class, teaching them all about necrosis and all about inflammation and all about those things? Leave the real pathology in the council. Why they don't agree to show some slides on that? I'm very pretty sure many of the pathologists accepted that. Accepted to train our students to do this, but many weaknesses between us, between our roles in the colleges, at the same time between our practices in our community. I did mention at the beginning, there is a shortage in pathologists. Why we still just keep ourselves back and wait until many patients dying, and many of them just have escaped because nobody could see them. They don't have availability for a consultant pathologist in Diana or I don't know why that. There is a gap there, and this gap should be filled. And we got leaders. They could try to get that. We need the health services here to understand this. We need to speak to ministers about this. We need to go out and scream and tell everybody the pain we are feeling. We could do something. Right. We need intelligent partnerships. When I'm saying intelligent partnerships, I'm saying this, we got a fantastic personal relations to get some people from the medical field help including pathologists. And not all the times we need pathologists. Sometimes I need really a pediatrician. I need to speak to him. I need him to tell me what he got, and I'll tell him what I got. I need some people to just go ahead and do their specialty in pediatrics from yourselves. How? In the UK, we got clinical biochemists who is specializing in newborn diseases. That's his focus, that's his mind, that's his life, that's everything. For 10 years, come back to this person who is really very keen, who is intelligent, who is very active. Give him everything, give him support, give him personal contacts. We are having an organizational support. We are not acknowledged in the NHS. Even unfortunately, and I'm saying this unfortunately, we are not part of NHS now. We are part of another ministry, I don't know. It might be a step, yes, to go ahead, leave that part. We'll come back to you very soon and very strong. I'm not, neglecting this, but I'm saying we have to be there. We don't need to go away and leave it for everybody. Many of the clinicians very keen to get us on board. And one day, one of the doctors touched my head and said, "I'm sorry, doctor. You are the one who's supposed to be doing this job." And that was Salih. We can do a lot. I'm not the most intelligent one here, or no genius, but I did what I could do at that time. Patients died. I went outside to cry because I felt my hands are being tied at the back. I can't cry, can't do anything. And I know everything better than the one who was holding the pen to write until the patient went away. This is not doctor's mistake, it's our mistake. As far as we are lying back and sitting and waiting for a magic to come and train us, that will never happen. And I've spoken about advanced and high specialty focused courses as well. And I need really the key people in universities to start thinking about focused courses. Ask your lecturers, come back with some proposals for certain courses that could benefit, that could help, and only help the patients, not help me to get a doctor name. I want to think like modern world. We think we are Muslims and we are doing everything good. No. They are doing most of the jobs. They are discovering all the things, and we are just waiting on the back and waiting for them to come up with cures new tests. My supervisor asked me, I give you money, go back to Sudan. If you got brains like the school you graduated you, and do research over there. Those people, they got money, they got everything, and they got brains running out in the streets. We got brains here. We need to utilize this. We need the key people to go ahead in every single institution and talk, get money, get research, cure people, help the needy, help the patients, help the sufferers. And finally on this slide, CPD. I don't want to talk about this. I think every one of us could be a week conference on single conference to sort out our problems. But CPD is very important, and I think others did a very good work on that, and just some on the association Facebook. But still, we need this to be organized. We need to have a body who should organize this. Technical excellence. Well, it's absolutely vital for high quality and accuracy for lab results. So, technically, if you don't know how to do a technique, then how can we do a right result? We know how sensitive it is. And I did mention at the beginning, the most sophisticated science in medicine is laboratory medicine. So you have to be really careful, and you need to be aware of what you are doing. You should be really focused. While you are doing a test, remember, that patient give you his life, ask you to help him, he's in pain. So just focus on that, do it right. If you don't know, it's not a problem. We got problems in our lives. We got every day different thing to think about. Give it to somebody else, because this profession is really vital. Knowing what you are doing. Why I'm saying knowing what you are doing? Bluffing, put it in whatever stand, look at under the microscope. If you didn't know what could get to stand what, you could get different things on that slide. You should be knowledgeable about what you are doing. You should understand the principle of every single step you are doing, and that useful in troubleshooting. If any problem happens, then you could go back to the step where you made the mistake and correct that mistake and come up with the perfect result. Encourage SOPs developing for the standardization of clinical cases. SOPs is special operation protocols. Every test in every single lab in the UK, they got SOPs for that test. This test done on that standard. Every hospital might got different SOP, but at the same time, you should stick to that because that one has been approved by your manager. And this will be reviewed every 1 year or 2 years. And we learn every single day from the day before to the perfection, to the quality, to have the perfect result where that clinician could rely on. Unfortunately, many laboratories, no, at that standard. And I will encourage this to be, teaching the salaries on every single module. They should have kind of how to do SOP. Accredited training laboratories. I'm really ashamed to say this in the first place because we don't do training. There is no standard training in Sudan. I don't know. Anything coming up? Anything we buy? Anybody knows anyone who is trying to prepare this?
We have a plan for training.
There's a plan for training.
That's what we have to work with suitable laboratories.
Accredited laboratories. How? Accredited laboratories. Accredited laboratories should have